All right, so thanks everyone for joining our informational webinar today. Just so folks know, this is being recorded for those that couldn't join us. We'll post it on our project page afterwards, but just wanted to let folks know. So this is an informational webinar on a new opportunity that the Center for Healthcare Strategies is facilitating with support from the New York State Health Foundation. And it's focused on supporting healthcare organizations engage with patients of color to advance health equity. And so just a quick overview of the day, or just the next hour. After welcome and introductions, I'll just share a little bit about the Center for Healthcare Strategies. Makaya Salisbury, who's our project officer from the New York State Health Foundation, is just going to give some opening remarks, and then we'll share some details on what the Learning Collaborative is about and the application selection criteria, and then we'll have ample time for any questions that folks have. And so just meeting the team, my name is Anna Spencer. I'm a Senior Program Officer at the Center for Healthcare Strategies. And a lot of my work focuses on consumer engagement strategies, best practices for healthcare organizations, Medicaid organizations to more fully engage with communities and patients, to both identify community priorities, to develop programs to address those priorities and health disparities, and really push a health equity agenda. And so I'm going to turn it to my colleague, Abina, and we'll just kind of go around the map here.
Thanks, Anna. Hi, everyone. My name is Abina Dakwahini. I am a program officer here at the Center for Healthcare Strategies. My work mostly is on the leadership and capacity building team. I'm really supporting Medicaid leaders in leadership, capacity building, professional development opportunities. But then I also work really closely with Anna and Rachel on the complex populations team and supporting Anna on this exciting learning collaborative project. Thank you.
Great, so Rachel.
Yeah, hi everybody. My name is Rachel Davis. I'm the Director of Complex Care at CHCS, and I'm really delighted to be supporting Anna and Abina on this project. We're so excited to have this opportunity, and grateful to the foundation for being able to tackle these two extremely important topics and conversations around how to more fully engage communities of color, and advance health equity efforts. And so appreciate you all joining today. Really looking forward to hearing about your interest or your questions. So thank you all for allowing us the opportunity to engage with you today.
Makaya, do you want to say hi?
Sure. Good afternoon. My name is Makaya Salisbury, and I am the program officer at the New York State Health Foundation for our Empowering Healthcare Consumers priority area, which is focused on two kind of core strategies. One is engaging patients as partners in healthcare policy, in healthcare and health policy decision-making, which is very much in line with this learning collaborative opportunity. And then the second strategy area of consumer empowerment is promoting information transparency in patient experience, quality, and price data. And I'll just echo what everyone else has already said, which is I'm very much looking forward to being a part of this webinar and hearing kind of where your interests lie, and answering any questions that you may have.
Wonderful, and I can't see all the faces anymore. Penelope, is she on the line?
I don't see her.
Okay. Makaya, did you want to sort of offer any other kind of thoughts on the Patients as Partners Equity Initiative or the Learning Collaborative?
Sure. I guess I'll say that this Learning Collaborative is an opportunity that really was spurred out of our most recent Patients as Partners Advancing Equity RFP. So last fall, we released a request for proposals, and it was the first of its kind for the New York State Health Foundation, where we were very intentionally looking for projects, and explicitly stated so, for projects that were focused around advancing racial and ethnic health health inequities. So we were looking at projects that, looked for ways to seek improvements in kind of our system, in practice innovations, and in interventions that were all designed to give patients of color a meaningful role in the healthcare system and in their health. And because we got such an overwhelming response to that RFP, and, recognizing that with COVID, the fact that, these patterns of inequities have always existed, but COVID has obviously heightened and deepened those racial inequities. We wanted to kind of seize this opportunity to continue with this work and recognizing there are so many organizations that are now, refocusing on their health equity agendas. And we wanted to create a space to kind of support and provide some thought leadership on ways that they can help kind of navigate their way through this journey that we're all on together. So that's a little bit about kind of what sparked this learning collaborative. And I'll turn it back over to you, Anna.
Thank you. And it looks like Penelope Campos from the New York State Health Foundation has also joined. Penelope, just want to say hi to folks on the line.
Yes, of course. Sorry, I'm late. I had a meeting that ran over, but hi everyone. My name is Penelope Campos. I'm the program assistant at New York State Health Foundation, and I work closely with Makaya for our consumer empowerment priority area here at the foundation. So I'm excited to be on the call with everybody.
All right, wonderful. Thanks, Penelope. Okay, so just a little bit about the Center for Healthcare Strategies. We are based in the Princeton, New Jersey area. We are a nonprofit policy center focused on improving the health and well-being of low-income Americans. We were started in 1995 through a major grant from the Robert Wood Johnson Foundation, and the mission was really to improve the underpinnings of the nation's healthcare safety net. Our work falls into three major buckets. The first is delivery system and payment reform. The second is services for people with complex needs. And the last is building Medicaid and cross-sector leadership capacity. We work with states, we work with health plans, providers, community-based organizations, and federal policymakers. And the activities of our work fall under sort of knowledge development, collaborative learning, which is what this learning collaborative is, technical assistance, and best practice dissemination. And here we have listed just a couple of our active projects, a lot really focused on health equity, improving access to care, and integrating the voices of those with lived experience into project design and implementation. And so just a little bit about the Learning Collaborative. This is a 12-month project. It is open to New York-based healthcare organizations, and it's focused on exploring and developing strategies to more meaningfully and effectively engage with patients of color to advance health equity. The purpose is to support healthcare and community partners, and I'll talk a little bit more about this team in a second. But to more intentionally partner with patients and communities of color through existing mechanisms. So these could be patient and family advisory councils, patient ambassador programs, telehealth modalities, is to develop a plan to leverage these strategies more effectively within internal health equity improvement efforts, and to think about ways to sustain these efforts by integrating engagement strategies into existing organizational structures. And so the Learning Collaborative activities, there'll be 10 virtual Learning Collaborative events, so webinars, where we'll bring in local and national experts. There'll be 2 virtual coaching sessions. So as part of this project, the Center for Healthcare Strategies is engaging with a health equity consultant. That consultant will help us develop the curriculum for the Learning Collaborative, but then will also be a support to the Learning Collaborative teams throughout the project period, through the virtual sessions, but also the coaching sessions that will occur at a couple of points during the project. There'll be some project implementation support, which I'll talk about in a second, resource sharing and peer-to-peer learning, and again, opportunities to have conversations with national and local experts. So eligibility criteria, this is open to New York-based healthcare organizations. So that includes hospital systems, community-based health centers or mental health centers, FQHCs, integrated health systems, and primary care practices. The expectation is that healthcare organizations will come with a patient representative or community-based partner. And so the Learning Collaboratives teams will consist of a healthcare side and a community side, and we leave some flexibility on what that composition will look like. But the point here is that there has to be a partnership with a patient or community representative. The selection criteria, so for those that have had a chance to look at the request for applications, we're asking folks to come with a clearly defined project that seeks to more fully engage with patients of color. This can be a new project idea that the healthcare organization and their partners are looking to stand up, or it can be something that's already existing that the healthcare organization is looking for more support on how to more intentionally engage with patients in doing so. There needs to be a compelling statement of interest for participation in this learning collaborative, and we ask that folks think about what it is that they want to learn through the learning collaborative, but also what they can bring to the learning community in terms of kind of experiences, challenges, learnings. There needs to be a demonstration of the prioritization of health equity at the healthcare leadership level. Again, there needs to be an established partnership with a patient representative or community organization that are committed to working on this project through the Learning Collaborative. Internal capacity to adopt and sustain the work that the Learning Collaborative will be supporting. So kind of a future for whatever the project is, sort of a commitment to sort of moving this forward after the Learning Collaborative is over. We would like to see a letter of support from healthcare leadership. And finally, a commitment to fully participate in the Learning Collaborative activities throughout the year. So that includes the virtual learning sessions as well as the one-on-one coaching sessions. And there'll also be an expectation that the Learning Collaborative teams will take some time in between learning sessions to sort of do some homework, but this will be sort of reflecting on what you hear during the Learning Collaborative sessions, how it might apply in your own organization, and then coming back to the group, willing to kind of share your learnings and challenges and really kind of support that peer-to-peer learning. And so I'm going to turn it over to Abina just to run through our dates.
Thanks, Anna. So this just gives us a little bit of a timeline of what we are looking forward to in the next few weeks. So in understanding that we are approaching a holiday weekend, we have extended the letter of intent date to June 2nd. So that is next Wednesday. So that is when the letter of intent is due. And the application is due the following week to CHCS. I think just email directly to me on June 11th. And then we are estimating a notification of selection date for early July. And then the Learning Community Kickoff webinar will be mid-July. So that is when you will get to meet the other participants of the Learning Collaborative and hopefully the equity consultants as well. And the Learning Collaborative time period is from July 2021 to June 2022. So we'll be spending a lot of time together once we notify the participants in early July. And to what Rachel said, the letter of intent is non-binding indeed. So it's good to just note that as well.
And I would just add in terms of the letter of intent, there's not a huge expectation here. If you could just send us an email letting us know that you plan to apply. It's really just to help us kind of plan for the review process. But this is not meant to be an outline of your project or sort of any of the components that I discussed, but just letting us know of your interest. And as Abina said, it's non-binding. If you know, after some further reflection, you realize that it's not a good match, that's we won't hold you to the application. And so that was actually one of the questions that came through on the registration form, just the format of the letter of intent. But I did want to open it up now for questions from folks about the Learning Collaborative or any of the information that we just covered fairly quickly.
And you're totally, you can use the chat feature or you can unmute yourself and ask the question. Either or is perfectly fine. I do want to note that also in the registration, I believe someone asked a question about a consultant, if like the healthcare organization could bring a consultant with them. We weren't really too sure of the question. So if the person on the line wants to further explain what that means, maybe that can help us make sure that we answer the question accurately. But I think, Mark, I see you've unmuted yourself.
Hi,
if
yes.
You want to start.
Good afternoon. Excited to see your program. We're very interested in it. So I'm with a community-based organization based in Brooklyn, Sickle Cell Thalassemia Patient Network, and Sarai and Halima are on, who are outreach and community health workers. So I'm thinking how we would apply. We have a partnership with Ambulatory Care Network in the Bronx, Bronx Care, which includes a network of FQHCs. So I was thinking about connecting with them. We've done work together in the past. Oh, is there any funding attached to this at all?
So there's a stipend available to support participation by the community partner, but there's not money available to the healthcare organization.
So basically in kind, time commitment. Okay. Yeah, we've participated in other learning collaboratives under HRSA grants, and they're very rewarding. And we also had some coaching with NICHQ out of Boston, a national improvement for children's healthcare. So it's a very nice model. Yeah. Thank you.
Okay.
Anna, I might, if it's okay, I might just take this opportunity to just kind of emphasize some of the learning collaborative components that you mentioned, but that I think to our mind, Mark, kind of get at what you're speaking to in terms of the ROI, so to speak, in terms of giving your time to this. So, you know, one thing that I want to kind of double down on that Anna mentioned is that on our end at CHCS, this is kind of our bread and butter. And so we have a deep, rich history of facilitating learning collaboratives and have really experienced a lot of value in bringing stakeholders together and actually have a lot of experience doing it in New York. And so anticipate being able to have this experience bring together old partners and new partners that you know, we've had great experiences working with. But another component of this project that I think we're really excited about is the opportunity to work with a consumer engagement and health equity expert who will be on board as a consultant to us and will really be leading the coaching sessions and will be partnering with us as we think about you know, how to structure and shape the learning community sessions themselves. So I just wanted to underscore that, you know, we always see value in these learning collaborative opportunities and are all the more excited that we have additional support from the foundation to be able to bring on board this consumer engagement health equity expert to add this like extra layer on top of the normal peer-to-peer learning of the coaching. So I just wanted to underscore that we are really excited and hope and imagine that will be a value add as part of this project.
Thanks, Rachel. There's another question in the chat. Can a nonprofit private service provider for people with disabilities that provides habilitative and Article 16 services, but is not a healthcare provider eligible, who primarily serve underserved individuals and families, mostly of color? You know, Rachel, do you want to take that one?
That's mental health, right? Isn't that included in your eligible entities?
Definitely, yeah. I might have to just reflect on that question just to sort of read it. I can't see the questions. And so what I did want to say is that questions that came through in the registration and the ones that we hear, we'll put together an FAQ document and post it to the project page. And if folks want to email us directly for direct follow-up, you're more than welcome to do that. Abina, can you just read the question one more time?
Absolutely. So the question is, can a nonprofit private service provider for people with disabilities that provides habilitative and Article 16 services, but is not a healthcare provider, be eligible? We primarily serve underserved individuals and families, mostly of color.
Okay, I'm not certain what the Article 16 is, so let us do some digging and we can post that answer on the FAQs.
Melanie, did you, just since this is like an intimate group here, I'm just wondering, Melanie, could we just actually take advantage of having you on the line? Could you just really quickly say maybe a little bit more about your organization, if you're willing to go on mic here so we can understand a little bit more?
Oh, she can't get her microphone to work.
Oh, okay. No worries.
That's New York statute. I think she might be with the developmentally disabled population. And those articles are referencing the New York statute.
Okay. Thanks, Mark.
So another person, Libby, thank you for the opportunity. Assuming we send our letter of intent directly to Anna and or Abina, or is there a general email? Yes, Libby, you can just send it over to me, Abina. That's perfectly fine.
And you're going to post the project page, I guess, where we find the application?
So for folks, yeah, we do have a project page. I'm not sure how you came to find out about the informational webinar, but we can follow up with, there's a revised date for the LOI. So as Abina mentioned, we recognize that tomorrow is the Friday before a long weekend. So we've extended that due date, but we'll make sure everybody on the line has a link to our landing page, which includes both the RFA. It'll have the recording for today's webinar and hopefully answers other questions. And it has also our contact information. So if you'd like to follow up, we'll be available.
And I just put the link to the project page in the chat, so you guys can access that for more information as well.
Any other questions from folks? Abina, I assume nothing in the chat to share?
It's nothing in the chat for now.
So again, recognizing that this is kind of a small group and we, you know, have some flexibility in terms of how to use the space, are there maybe not questions related to the application, but just general comments or, you know, other pieces that folks want to raise while we've got the opportunity to sit together and just consider this opportunity? We can be very open-ended in what we think of as questions in this part of the section here. If there's any other sort of comments that folks want to flag while we've got the our internal CHCS project team and the foundation on the line. Or have we done an amazing job of explaining all the angles here of this project and there's no further questions?
I did get another question in the chat privately about where can I obtain the LOI. If Anna, you just want to explain a little bit again about what the LOI should look like.
Sure. There's no form. We wanted this to be easy for folks. And so if you just want to send Abina and or myself a very quick email indicating your intent to apply to the opportunity, that will just be more than sufficient. So it's not, I mean, you know, some letters of intent are very kind of extensive. They outline your project idea. We just want to get a sense of how many applicants we're going to get, just to kind of do our own internal planning. So a very quick email will be more than enough.
Thanks, Anna. So Lean asked, I joined late. Will you be sharing the recording? And yes, we'll be posting the recording on the project page for easy access. The next question is, how many projects / healthcare organizations will be selected to take part in the Learning Collaborative?
So we'll be selecting up to 10.
Thank you. And then the next question is, can you talk a bit more about the level of leadership support you are looking for?
So we're looking for a letter from healthcare leadership that indicates not only a commitment to engaging with communities, particularly those of color, for participation in the Learning Collaborative. So that's an acknowledgement that there's some time, staff time and effort that will be involved, that there's some leadership support. And you know, as we discussed, this sort of is an in-kind effort on the part of the healthcare organizations, but that folks will have the space and time and support to do this. And also, I think we're looking for just a commitment to really engaging with communities to address health disparities and advance health equity.
Yeah, and that's great. I mean, I think the other thing that I would add, just in terms of the, you know, the formal requirement to include a letter of support is just, I would just encourage folks to take a look at the RFA and the, you know, the questions that we ask there. You know, there's a question around, you know, what your project plan is, the statement of interest, you know, sort of what you imagine you can both bring to the learning community and what you imagine you'll be able to get out of it, speaking to your internal established equity efforts, the community partnerships that you'll be leveraging for this project, your team composition. I would just say that we do, this is going to be a competitive selection process. And so to the extent that there are opportunities, you know, to speak to a commitment, not necessarily on the part of leadership explicitly, but you know, your organization or the partners that you're bringing together to really lead and you know, see these efforts through. I think weaving in any of those, anything that you can say about that commitment in general, including from leadership, to the topics that we're going to be tackling through this application will be to your benefit and make an application more competitive. So it just underscore that, you know, there's the formal place where we're looking for a letter of support, but in addition to that, there's certainly opportunities for folks to help fill in additional details, just underscoring organizational or partnership commitments to these issues that would be definitely of interest on our end to understand.
Thanks, Rachel. There's nothing in the chat right now. And I also wanted to just point out, I think that we put also in the RFA that we do expect participants to probably also meet outside of kind of the scheduled sessions on their own time. for, you know, maybe 2 to 3 hours or so, just to kind of, you know, discuss what you learned maybe during some of those sessions and how it can kind of relate to your work and things like that. So I think that's also kind of part of that commitment that we're hoping that your leadership that your leadership understands, and that you understand as being a participant of the Learning Collaborative.
Okay, well, if there are no more questions, just recognizing, oops, is there one more, Abina?
Just a thank you from Mark.
Okay, all right, wonderful. Thank you all for joining us today. We are available for any questions, follow-up that you might have. We'll make sure that everybody on the line just gets, I know it was shared in the chat, but we'll share it with registrants, just the link to the project page, which includes the RFA and the key dates. And again, if there are any other follow-up questions that you think of after the fact, please feel free to reach out. Thank you for your time. And Makaya, anything you want to add before we sign off?
No, just looking forward to hopefully reviewing some of your applications.
Yes, definitely. All right, thanks for your time, everyone. Have a great rest of your Thursday.